That sounds great. Awesome.
Okay, great. Well, thank you so much for having me today. It's so good to see everybody, and it's so great to see you, Zoe. So my name is Sarah Gunther. I am the Executive Director of Key Consumer Organization. We are a consumer-run organization based out of Indianapolis. If you want to go ahead and go to the next slide. Okay, so KEY actually stands for Knowledge Empowers You. It's an acronym. So Key Consumer, who we are. We are a consumer-run organization. That means that we're all consumers of mental health services. Some of us have substance use issues as well. And we are all consumer staff, and then at least 51% of our board of directors are consumers as well. We started in 1988. We got our nonprofit status in 1992, so we have been around for a very long time. What is our mission? Our mission as Key Consumer Organization is the organization of people in recovery. We empower others. To, sorry about that, to find their resiliency, mental health, and wellness through education, advocacy, and support. We are individuals in recovery, and we want that to be right there in our mission. What we do, we have the mental health peer run warm line, a quarterly newsletter. We refer individuals to resources and advocate individually and collectively through places like the community mental health centers as well. Okay, next slide. Okay, great. So here's the warm line information. There's our number, 800-933-5397. We are open Monday through Friday from 8 to 4:30. We are a non-crisis talk line. So if someone is, needing someone to talk to, but they don't see their therapist for a while and they want to talk to somebody who maybe has been there and can understand a little bit about what they're going through, they can talk to us. You can speak to a peer supporter, someone with lived experience with either mental health issues and substance use issues, or just mental health issues, depending on who you get. Our goal is to empower, support, and encourage. That is really what we are there for, is to empower them and to encourage them to take part in their wellness. We use our lived experience to inspire hope. The warm line is non-judgmental, and we walk with individuals. We really encourage them to take an active role in their wellness, and that's what's next. Encourage individuals to take an active part in their wellness. We want them to not just be participant, not just be passive, but to be participants. And since this is their life, they have a large part in their wellness. Next slide, please. Thank you. Why a peer supporter? The peer supporter is an individual in recovery with mental health challenges trained to provide support and empowerment. And really that mutual connection is really important in promoting recovery and getting people to really do the hard work it takes to recover. A peer supporter can use their lived experience to encourage individuals to focus on strengths and take an active role in their wellness and recovery. That's what we want. We want people to have their say, and we want people to do what they can, whatever they can, to promote wellness. Peer supporters promote recovery, resiliency, and whole health. It's important that the whole person be addressed. Spirituality, financial, mental health, physical health, all sorts of wellness needs to be addressed within each individual. Peer supporters use mutual support to benefit everyone. It is really such a wonderful thing about peer supporters that we get to help them and they help us. I can't tell you how many times I've worked on the warm line for years, and I really got a lot from helping other people, not just helping other people, but some ideas that they came up with. They're the experts on themselves, and they know what's helped them. They've talked to other people. We would have a back and forth about what helps, what doesn't, and you learn a lot about yourself as you use these skills to help others. Peer supporters promote, Peer supporters promote the idea that an individual is an expert on themselves and honors the knowledge an individual has about their life. And then we use that knowledge for ourselves and for the people we're supporting. That back and forth is really what is wonderful about peer support. Some questions we consider on the warm line. What is going well? Sometimes when we get in a rut, we think about everything that's not going well. What is going well? What do you want your life to look like? Maybe instead of moving towards what we don't like, maybe there's some way we can move towards what we want. What do you have control over? Focus on the things that you do have control over, and then that's where your power is. What changes can you make to take more control of your wellness? Is there something that you can do to be more centered in your treatment, or in any way in your wellness? What do you enjoy? How can you do those things more? What are your strengths? What are you good at? So strengths based is, obviously always good, but we like to focus a lot on that. And what have you learned from your challenges? These are things that we don't always think about when we're in the challenges, but are we more empathetic? Have we learned better where people are coming from? Are we less angry because we understand that people are going through things? These are important things to think about, is what have you learned from your challenges? Okay, next. Okay, so recovery, a little bit of review. The SAMHSA definition is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Peer supporters can promote recovery by using their lived experience to connect with individuals and encourage them to focus on their wellness. We want individuals to be focused on recovery, on resiliency, and to really focus on their wellness, because recovery is hard. All our peer supporters are in recovery and well enough to work or volunteer and use their lived experience to help others. Peer supporters show everyone that recovery is possible. Really, hope is our job. We want people to see us in recovery and to know that recovery is possible, regardless of diagnosis, regardless of symptoms. We want to move towards that place where recovery is expected for not just substance use, but for mental health as well. And we work every day on our warm line to move in that direction. Okay, next. So here's a little bit about our values. Self-determination, we want people to have their say in their own lives. Peer support, we want to provide support to individuals and have them in us helping them, they help us. In us helping them, they help us. Holistic wellness, all 8 dimensions of wellness. We want your entire life to be as well as it can be. Empathy, we walk with you. Compassion, growth. It's super important that we talk about how we can grow and how we can really have work toward the lives we really want. Empowerment, we want individuals to have that sense of empowerment. We fight stigma every day. And recovery is for everyone, regardless, like I said, regardless of diagnosis, regardless of symptoms, recovery is for everyone. And so here's my information. That email is the best way to get a hold of me. If you need any more information about Key Consumer, there's our website. And you can always email me to sign up for our quarterly newsletter. And that's really it. It's short and it's brief, but I wanted to make sure that there was plenty of times for any questions or anything that anybody wanted to ask.
So Sarah, I had a question. If people do not know how to get plugged into Key Consumer, what would be the best ways for them to get plugged in?
Well, plugged in, I would email me if there's anything specifically that you have any questions or concerns or want to sign up for the newsletter, but you can go to our website to see a little bit more about us. Emailing me with any questions would really be the best way to move forward. If anybody has any ideas on collaboration or any questions about us.
Any other questions from the group regarding Key Consumer?
Yes, I actually have a group. My name is Dr. Rogers. I'm with Edgewater Health. Can you hear me?
Yes.
Okay, it's kind of early in the morning here, so I'm sorry, but forgive me if I don't put the video on. But I had a question for you. Great presentation, great work. I do appreciate it. I'm sure your community appreciates it as well. The question is, do you have a criteria for the lived certified peer support specialist? I mean, like, do they have to have a length of time that they've, remained abstinent from any type of substance abuse or anything? Do you have any criteria that that they have to meet?
For time in recovery, we do not. If someone wants to work or volunteer for us, the first process is for me to meet with them and discuss their recovery process, discuss where they are. It's especially with mental health issues, it's hard to define where you are in recovery, and especially even with substance use issues. Sometimes there's going back to substances, but it doesn't reset the clock. So really you have to have a conversation with somebody about where they are, how are they coping, how is their resiliency right now, is now a good time for them. So we really we do it person by person when it comes to working on the warm line. And there's a lot of training that has to go in. You have to learn how to use the warm line. You have to have some training on stigma, and you have to, have some training on how to support people and not share too much. These are all things, you, even though you have your CPSP or, you volunteered before, there are certain things you still need to learn. And so we don't necessarily have, like, if you're not without substances for this long, or you're out of the hospital this long, it's very individual based on what the person has going on.
Okay. All right. Because I guess my concern is, if they're too early in recovery, we've had a certified peer support specialist, but then we all know that relapse is part of the program. But, that's very disruptive to the individuals who we're serving.
Mm-hmm.
That's why I asked that question.
Yeah, absolutely. And it's, it's a good question, because I don't know that necessarily a length of time would be something.
Right.
I think that having that conversation with them about where they are in their recovery and how comfortable they are sharing what's going on in their lives, how comfortable they are sharing what is helping them. I think that for us has been the way that we determine if someone is ready to be on the warm line.
Okay, thank you so much.
Thank you.
Thank you for your question. Any other questions for Sarah? Well, if you think of any, you will have her contact information. And I did want to give a couple quick updates from a council standpoint. I love to use this opportunity to connect with all of you. A lot of this went out in the update last week, but in case you have not had a chance to read it, I do want to recognize, speaking of recovery, that September is Recovery Month. And I do want to thank everyone on this call for the work that they've done within the recovery community and helping those reach recovery. So thank you for that. And there's resources on that link that I emailed out to all of you for National Recovery Month. I also wanted to highlight just a couple quick things. Those are all of our meetings that are coming up. You have those in the update. 2 new ones, actually 3 new ones. I think my team, if I start another committee, they might kick me, but we started a residential treatment subcommittee that some of you are on. And that is really to learn from each other about the residential services of our 3.5s, to be able to refer to one another. As we all know, we have a very aggressive, sorry for my dogs in the background, very aggressive market here when it comes to residential treatment with some for-profits. And so we're really trying to build our system and refer to one another and strengthen our system. The other new committee, I want to thank Radiant Health. This was their idea because they just went through an amazing name change, but a marketing committee. And so we have several folks there if people want to get plugged in to help us with our system-wide message. And then we also started back up or have continued our data analytics. And if you're not plugged into that, we have a data project warehouse manager starting on Monday. And so that project for that statewide data warehouse is really going to start taking off. And so if you're not plugged in, please do so. And then I wanted to also share our fall conference has been locked in. Denise did a great job and went down to Bloomington. Bloomington was such a success the last time that we're doing it again. It's a great location at the Hilton Garden Inn. We have a national council, CCBHC expert, really one of the ones who really helped champion CCBHC with Dr. Joe Parks. Her name is Rebecca Farley David. She's going to be kicking us off in the morning. And then the state actually asked if they could have longer time with us. So they're going to be meeting with us for about 75 minutes. And that's going to be going over everything CCBHC and then also giving a high level on the readiness assessment. And then we're going to review the great work that our Racial Equity and Leadership Committee has been doing with our class assessment that all of you submitted, as well as a workforce panel with several state resources there. So if you've not registered, please register. I think we're gonna really have a great turnout for this. And then just a couple updates around payment, because I know funds are important. I see several CFOs on the call, so I want to make sure to speak to this. But the bridge grant claims are all submitted. We're waiting on the state for payment. So as soon as the checks will be out, the checks will be sent out. We also received last week the final group home capital. Scott, I see you on the phone, was very helpful in this effort in the group home capital. And so we will be getting those individual contracts out. Andy's working on those this week. So if you submitted a request for capital, that's new build and current build. And it's roughly around $14 million. So I think the council right now administratively is right around $70 million that we've advocated for you in the past 2 years, which is something we're really proud of. So be looking for that contract, CEOs and CFOs on the call. And then National Council Hill Day at Home, I included this in my update. Be great to have people on and plugged in on October 18th. Remember, with National Council, we are 100% membership state. So everything for National Council, we get membership discounts. All of you do. So you can get plugged into that for Hill Day. And then some of us, some on the call, are going to DC together. We're going to have a ton of fun, and we're going to meet with all of our federal legislators on October 24th and give Senator Young the Federal Legislator of the Year award. So looking forward to that. You've not had a chance to connect with your local legislators, now's the time to do it. They're going to start ramping up here with policy and policy ask. And so we need to make sure with this short session, people know who all of us are. And then just other reminders, if you know any potential new members, if you want to reach out to Leanne. And then of course, I have to share about the PAC, especially with the governor race coming up. If you're so inclined to donate to our PAC, public policy is in charge of that. And we really need to be able to bolster those funds, especially with the upcoming race. So without further ado, if you have any feedbacks, our speakers for this session, like Aspire did with Key, please pay forward. Please email either Denise or myself. And then we have a winner for the Starbucks gift card here. Let me pull that up. And that is Jonda from Radiant. Where are you? There you are. There you are. So does anyone have any questions for Sarah, myself? I know I blew through that really fast, but anything that's on your minds that I did not address? We're all coming back from Labor Day and still need another day to probably wake up, right?
Hey Zoe, this is Connie Kerrigan calling
Yeah,
from
hi, Connie.
Park Center.
Hi.
Hi.
Yeah.
I guess one of the questions I have is, as we're preparing as a state to move forward as CCBHC, there was an opportunity recently that went out, I think in the spring, for us to apply for $4 million over 4 years. And I was just curious if anyone would get that grant, how would that be factored into what we're doing here?
Yeah, that's a great question. So what you're referring to is the SAMHSA funds that came out. We're going to know about those. I'm hearing like mid to late September who was awarded. I'm also hearing, though, that it was very competitive. And so that does have a little bit of concern about what will come to Indiana on a federal level. But basically, what we'll do is we'll look at who gets awarded and then who does not. And then remember that 100 million that the state got, the 50 and the 50 for mental health. And they're really focused on crisis services. But once we know about the CCBHC opportunity there and who wasn't awarded, we can really advocate for the funds there to help in getting us to 2027 when we're all CCBHC. Does that make sense, Connie?
Yeah, so I was just curious. I mean, so you're thinking that if someone would get that grant, that they could accept the grant, and you would just reallocate other dollars somewhere else?
Yeah, we'll be able to reallocate and then also advocate for those who did not get it based off of that. Mhm.
Okay. All right. Thank you.
You're welcome. Any other questions? That's a great question.
So I have a quick question. I know you said we're going to get the contracts for the SGL Capital soon. Do we know, has anybody been told what they're getting or for what projects?
Yeah, so Andy and I did the math on all of that. And so your ask will be roughly right around 90% of what your ask is based off of that total ask from everybody.
That's awesome. Thank you.
Yeah, it is awesome. Great question. Any other questions? We have 5 minutes. You got 5 minutes to ask me anything. I guess since we do have a minute, I see Seth on. Seth Warren is the new CEO of Meridian Health Services. And so really looking forward, he just waved to everyone, really looking forward to working with him. And so wanted to welcome him. And then I see several other new faces, especially from Park Center. So thank you for being on. And anything I can do to help you guys be plugged in, don't hesitate to reach out. All right. Well, I don't know if we've ever ended a cup of Joe early, Sarah. So they have your contact information. So way to be efficient. Denise and team, am I forgetting anything else for the group? Or did we cover everything? We're good? All right. Well, then let's raise our cups. And cheers to all of you for the great work that you guys do. If there's anything that we can do to bring value to you, please do not hesitate to reach out. Appreciate all of you. Have a great day. Take care.